Hello, everyone. Welcome to our show, Discover the Best You. This is Dr. LaTanya Bowman here, and I'm your host here on WDRBmedia, the voice of the community. Definitely check us out every Thursday at 2 p.m. here on WDRBmedia. I appreciate you guys tuning in today. And today is going to be talking about the stigma of therapy. We all know how much the African American community is scared of going to the therapist. So I have a great friend of mine, Darnita, who is going to be discussing about why it's great to go to a therapist and why it's healthy to go to a therapist. How are you doing today?
Oh, I'm doing great. Thanks for asking. How are you?
I'm doing good.
Awesome.
Thank you. So, you are a patient of mine as well.
Yes, I am.
And as you all know, I bring on different counselors, different physicians, just to talk about health and wellness. And therapy is very important. We just don't realize how important it is until, I guess, as we get of age, of how that is something that we definitely need to implement into our practice of health.
Absolutely. I'm glad that you said that, because it is a practice of health, and we have to exercise everything. So we have a lot of people who are now getting more physically fit by going to the gym or doing different things, right?
Right.
And so we go to our doctors also for our physicals, things like that, to make sure that our body also is okay.
Right.
But a lot of times we skip the mental portion.
Yes.
The check-in.
Yes.
So.
Absolutely. So give everyone a little background of your practice. Mm-hmm. How long have you been in practice? What made you become a therapist? Mm-hmm. And how can they find you?
Okay, great. So, again, my name is Darnita Samuels. I'm a licensed marriage and family therapist here in the University area of Charlotte. I've been in private practice now for almost 4 years, in therapy for 7 years.
Okay.
And so my practice, again, is off of W.T. Harris and Mallard Creek. In that area. Now, what made me get into it? This is a multi-pronged thing, and I know we don't have all the time in the universe, so I'll give you the very condensed story.
The CNN version.
That's right.
All right, gotcha.
So, years ago, my life was planned in a different way.
Right.
But I would always get lost in my cereal aisle trying to find my favorite cereal. Mm-hmm. Whenever that would happen, someone would come up to me and tell me their whole life story. And then they would want me to help them. My statement would always be, well, I think you need to go talk to somebody.
Yeah.
And they were like, well, shouldn't I be talking to you?
Right.
And I'm like, no, I don't necessarily like people. Mm-hmm. So fast forward for all these times happening.
Right.
I'm originally from Detroit, Michigan. Relocated here to North Carolina. My life literally went to hell in a handbasket. Okay. My primary care physician was like, you're going to see my therapist. That shocked me, first of all, because my primary care physician, who I thought was the greatest ever, didn't think she would really have these type of problems, right?
Right.
So when she said she went to a therapist, it was like kind of knocked me out of my square. I was like, oh, you go to a therapist? Seriously?
You saw that she was human.
Yes. You know? And so then she was like, yes, and you're going to go see her too. I went to see her. Okay. Saw her for about year and a half.
Okay.
Battling deep depression, different things like that.
Absolutely.
So she helped me. In between, it started to click like, was this all the reasons why those people would tell me their life stories when I was looking for apple cinnamon Cheerios? Maybe. So then I went and found a program. Okay. That I could get into for counseling, because I was like, I'm not doing any prerequisites. They better accept what I have, because I already had an undergrad degree and 1 master's. Right. Okay. I wasn't going to go back and take more. I found Pfeiffer University's Marriage and Family Therapy program. Oh, yeah. I started May of 2010. Okay. Got the best training, I will say. I have got the best training there ever. But then also I learned a lot about myself, because a part of the program as well is this. You're expecting people to come into your office and talk to you and spill their guts, basically. But if you've never been to therapy before, you do not know the vulnerability of sharing. Absolutely. So we had to go to therapy ourselves again. So locally here, found another one. She happened to be a student intern at the time. Okay. Couldn't tell, because she was awesome and dynamic, and she still is. She helped me grow even further. She helped me uncover a lot of things that I wouldn't have been able to without the assistance of my first therapist. So I started my healing process then, went to her, continued it more. And so then it was like, okay, I know this is what I'm supposed to be doing.
That was your calling, huh?
Yeah, yes.
Yeah.
Graduated from the program, and about a year after that, or no, 9 months later, I started my practice. And here we are today.
And what's the name of your practice?
So it's my name. It's Darnita D. Samuels.
Okay.
MSA, MA, LMFT.
Very nice. How can they find you? What's your phone number, office number?
My office number is 919-807-1692.
Okay.
They can also check me out on the web. It's darnitasamuels.com, and that's D as in Deborah, A-R, N as in Nancy, I, T as in Tom, A, Samuels.com.
And, I like how you described family therapy as well as marriage.
Yes.
And interesting enough, those two definitely go hand in hand, especially with the African American community. One of the things that I have found that even as a physician, when patients come into our office, regardless of whatever ethnicity they may be, you find yourself becoming a therapist too.
Yes.
And so you'll hear them start talking about what goes on at home or what's going on in their marriage. And then you find that you're having to soak all that in and trying to educate them. And one of the things that we always tell them, go to a counselor. Go to a counselor. And so that's one of the things why I try to make sure that I know all different kind of physicians as well as any health providers to lead people to that direction.
Yes.
And again, that's one of the reasons why I created this platform. So people can recognize and find these healthcare providers so they can go to them and also be able to hear what you all have to say.
Yeah.
Now, with marriage as well as family, I'm trying to figure out how to explain this. I've noticed that, again, with the African American community, a lot of us come from broken homes.
Yes.
And a lot of us have not seen a healthy dynamics of marriage inside their homes.
Yes.
And when we become older, now that we are of age, we see how that affects us in our lives and actually creates patterns.
Yes.
So I just want you to kind of bring that kind of topic out, and again with the stigma of therapy, why it's healthy and good to go to a therapist, because some of that stuff comes from childhood.
Oh, absolutely.
And gets pulled out into as an adult, and what happens, it triggers your relationships, friends, family, and your marriage.
Oh, absolutely. Yeah. So you covered a lot in that one statement. And so with marriage and family therapy, I want to clarify too, because a lot of times people will think that I only work with marriages or families.
Right. Okay.
I actually do individuals, I do premarital, I do just dating, couples and family. Right. And I also lead some groups as well. But with that, right, you're talking about broken homes. A lot of times people think about broken homes as if a parent is out of the home. Yes. But a broken home can actually have two parents who are fully functioning in a marriage or relationship, and it can still be broken.
Absolutely. And a lot of people misunderstand that.
And that's true. And that's
just
true. Just
because you got two family members inside of a house does not mean that it's a healthy marriage or stable house inside that household.
And that's it. And a lot of times people get discounted as well, and they don't even understand. Growing up with a two-parent household doesn't mean it's healthy, right?
Right.
And so sometimes they kind of push it to the side, well, at least I had both of them, right? And so when you're talking about those, we talk about intergenerational things that come on, right? One thing that we do is called a genogram. And so in a genogram, we break down all the relationships that you have, current relationships with your family of origin, meaning the people who actually raised you. Doesn't have to be your parents, okay? It is your primary caregiver of who had you basically your entire life and reared you, showed you what was right or wrong.
Right.
We look at your sibling relationships. We look at the primary caregiver relationships, and then we go back at least 1 to 2 more generations. And it looks like, the ancestry shows like Finding Your Roots or something like that, right? But we look at the relationship roots. Because a lot of times people are struggling with things that are happening right now, right? But they don't even know why they're struggling because the traumas have been passed on.
Yeah.
And say, I'm your mother, okay? Something happens to me, but I'm going to raise you as if something happened to you, but it didn't. You are now forced with the things that I've been saying that happened to me, right? You may not know. I don't tell you these things, right?
Right.
So now you have no point of reference of why you're dealing with a trauma.
Right.
But I gave you my trauma. Mm-hmm. Now, is it purposeful?
Displacement.
Yes.
Okay.
Or it can be transference. Right. So with that, you are now lost. You don't know why, but you're living out my trauma, but you never experienced it.
Absolutely.
So now that level of dysfunction sometimes still stirs, mm-hmm. right? And it can go forward. Mm-hmm. Now, what we try to do is stop it and try to understand what happened in these relationships, right? And what is coming through, because it can sometimes feel normal, or you feel like something is wrong, but you don't know why.
Right.
So when we bring these things to the light, we look at, for instance, relationships where there's substance abuse, alcoholism, things like that, mm-hmm. A lot of divorce, things like that. You're like, okay, well, why do I always have this attitude that, I don't necessarily need a partner, or a partner is exchangeable?
Right.
It could be because the last 4 generations in your family they've been divorced by a certain age. Mm-hmm. And so you're used to seeing certain things and experiencing certain things.
Those patterns.
So therefore, right, mm-hmm. these people don't stay.
Right. You automatically already have it in your mind the person is not going to stay.
Exactly. Mm-hmm. And so with that brings on other things. What you also talked about is what we refer to as attachment. And so how do we attach to the people who cared about us? Stigmas can come out of all of that, right? Mm-hmm. Because a lot of times we will say, as Black folks, we give other things names, right? So yes. Diabetes is, used to be sugar, right? We say, somebody with anxiety, oh, nerves is bad, mm-hmm. right? Somebody who's schizophrenic, oh, just leave him alone. He having a bad day. No, he's schizophrenic. He is literally hearing voices.
Yes.
Okay. And the voices are literally telling him to hurt somebody here. Mm-hmm. So we've got to now start calling it out. But we didn't want anybody to know our business either, because the old statement was, what happened in this house? What? Stays
in the house.
Exactly. And then also, we didn't give ourselves permission to even think about a therapist. It was like, we don't do that.
Well, we always look at it as going to church.
Right. And go pray on it.
And pray
right?
on it. Mm-hmm.
Well, I'm here to tell you that it's okay to have Jesus and a therapist.
Absolutely.
Okay? We can both help you, because if you really want to get biblical, faith without works is dead.
Amen.
Okay? So we have all of those, plus the stigma of people not knowing. Are they going to mess with your mind? Are they going to make you do something you don't want to do? What you going to tell them about me? So those things like that. Mm-hmm. Then we also have it because, our roles in the family. Will we lose the role that we have in the family, our place? So there are a lot of things involved. And then also, what will people think? I get a lot of people in my office, and they're literally like, so do you think I'm crazy?
Right.
My question to them is, do you want to be crazy?
Right.
I can take you someplace and I can show you what, disturbed is, and you will want to get out.
Right.
So that's the thing too, the fear of a diagnosis. Because I will say this, and this is a general statement, but there's research that corroborates this. Black people are misdiagnosed all the time.
Oh, we were misdiagnosed even as, especially little boys,
yes.
with ADHD.
Yes. No one asks the questions about what's happening in the home.
Absolutely not.
And yes, if the child has not eaten in 2 days, if the child is not sleeping well, that child is either going to act out, they will fall asleep, they'll do a lot of different things to say what they can't verbally say, right? So there's a lot of things that are involved that people don't pay attention to when it comes to us as people.
Well, I will say that this is a great topic. We will definitely have to continue it.
I would love to.
This is an awesome topic. You guys, make sure you tune in to us. We're going to come back in the next show discussing this topic even a little bit more deeper. So thank you for coming to the show. And again, tell them how to find you.
Thank you. Again, and my number is 919-807-1692.
And again, thank you for coming and listening to us today here on Discover the Best You. My name is Doc Bowman, and you can find me at 704-946-2054. That's Discovery Chiropractic and Wellness Center. Our office website is discoverychirowellness.com. Again, Discovery, CHIRO, wellness.com. Thanks, and tune in soon.